Okay. Hello all. Today we will be discussing the West Nile virus, a mosquito-borne disease that's a significant public health concern nationally in the US and in our state, Massachusetts. We will cover the basics of the disease, its epidemiology, clinical features, and some prevention strategies. So what is a West Nile virus? The definition, West Nile virus is a mosquito-borne disease that can cause severe illness. Transmission is primarily through the bite of an infected mosquito, and the virus circulation is between mosquitoes and birds, with humans being dead end hosts. As you can see in this West Nile virus transmission cycle here, it's usually through um, mosquitoes and birds, and then sometimes it can infect humans and horses, other mammals. So, as we know, West Nile virus is primarily transmitted through the bite of an infected mosquito. A mosquito-borne virus, flavivirus, is the most frequent cause of arboviral disease in the continental US and is recognized as the most widely distributed arbovirus in the world. West Nile virus is primarily maintained in a enzootic transmission cycle between Culex species, mosquitoes, and birds as the host. Epidemic and epizootic transmission occurs when the virus escapes the bird-to-bird and zootic cycle to infect other vertebrates, including humans. So, the West Nile virus has been detected in 65 different mosquito species in the US. Only a few Culex species drive epizootic and epidemic transmission. So, these are the most important Culex vectors as they travel in the northern states, southern states, and overlap in the western states. Symptoms and severity. So the symptoms of West Nile virus can range from mild illness to severe neurological diseases like meningitis and encephalitis. Um, and the severity is, it's obviously higher risk for individuals over 50 years old and those with weakened immune systems. And this can lead to hospitalization and or death. Incubation period for West Nile virus is typically 2 to 6 days. 80% of the people who are infected are usually asymptomatic, so there will be no symptoms that you can tell. 20% of them develop mild illness, including fever, headaches, body aches, sometimes rashes, and around about 1% or less may develop severe illness such as encephalitis or meningitis with additional neurological effects. So neuro, so it is broken down into neuroinvasive diseases and non-neuroinvasive diseases, just for surveillance purposes. Um, so neuroinvasive diseases such as septic meningitis, encephalitis, or acute flaccid paralysis can develop with additional symptoms of fever with headaches, myalgia, stiffness in the neck, altered mental status, seizures, limb weakness, or cerebrospinal fluid. Whereas non-neuroinvasive diseases develop fever, chills, but have the absence of those neuroinvasive diseases symptoms and the absence of or develop acutely with the other clinical symptoms. So providers, please look out for anyone presenting with the neuroinvasive symptoms as they can develop quickly over just a few days. So of course, there are higher risks among the elderly population and those with already weakened immune systems. So epidemiology, so this is the geographic distribution. West Nile virus is a national concern with cases reported in multiple states since 1999. Seasonal pattern, usually peak transmission during summer and fall months. So during the first 10 years after West Nile virus was first detected in the US in 1999 in New York, the annual incidence of neuroinvasive disease fluctuated considerably. So recently, it's been more stable where the national incidence of neuroinvasive disease is at around 0.44 per 100,000 population. Despite this stability, the occurrence of West Nile virus disease cases continues to be sporadic when assessed at the state and county levels annually. So here is the Massachusetts reported West Nile virus cases from 1999 to 2004. And please note that it didn't actually enter Massachusetts until 2001, whereas the United States report, it started in 1999, which was from New York. And this is a total overall throughout all of the states. So the West Nile virus in Massachusetts, the Massachusetts data is this is the most recent in 2025. Cases reported in several counties, including Worcester and Middlesex, and mostly consist of uh, male gender over the ages of 50, presenting of encephalitis, meningitis symptoms. So in Massachusetts, West Nile virus occurs seasonally between June and October. The the disease has been detected in several counties, as mentioned, Middlesex and Worcester, and we do see a higher incidence of the cases in specific individuals, as I mentioned earlier. So prevention is key. Please recommend and educate individuals to utilize the personal protective measures. We need to be proactive in high-risk communities. So personal protective measures include avoiding peak mosquito hours, wearing protective clothing, using insect repellents. So we should use EPA registered insect repellents with deep permethrin picaridin, um, or oil of lemon eucalyptus. And please note and please educate our patients that these products should not be used on young infants, and permethrin is intended for items such as clothing and should not be applied directly on the skin. So, the protective clothing should be long sleeve shirts, long pants, and socks when outdoors, and remove any standing water around the home to prevent mosquito breeding, as that's a big thing for mosquitoes breeding sites. And we also want to replace and repair windows and door screens. This will help prevent mosquitoes from coming indoors. So the high risk groups were also previously mentioned, but we want to make sure um, that we pay attention to individuals over 50 years old, individuals with already weakened immune systems. And from this chart here, from the CDC, this was um, a graph that displayed the differences of male and female incidence of West Nile virus disease, and it showed that male are more susceptible to this disease. We also want to be careful and educate those who are outdoor workers, such as construction workers, agricultural workers like farmers, people who are in grassy, bushy areas, often all day landscapers. They are part of those who are high risk. Okay, so public health response. In the state of Massachusetts, confirmed cases should be reported to the local Board of Health, the Massachusetts Department of Public Health, Within 24 hours, a confirmed case of West Nile virus needs to meet the clinical and laboratory criteria of symptoms, as mentioned earlier. It could be fevers, chills, sometimes rashes. And also they must also have serological laboratory testing that has to return positive for West Nile virus. So the positive results from the healthcare provider and the positive laboratory results must be reported or submitted electronically through the Massachusetts Virtual Epidemiologic Network, aka MAVEN. So nationally, the West Nile virus should be reported within 4 calendar days, and the CDC oversees national surveillance through ArboNet, which is a surveillance data capture platform for arboviruses such as the West Nile virus. But we also need to continue to provide education to individuals from these high-risk communities about mosquito control around the home during weather changes and emphasize behavioral change. Please use the listed resources and the West Nile virus fact sheet handout to provide to individuals and patients who you may think of can benefit from this. Also, if you are looking for the case definition for reporting and surveillance, that can be found in the link, um, West Nile virus case definition here below. So as public health managers and providers, it's essential to be aware of the risk and take proactive measures to prevent West Nile virus transmission. This includes conducting mosquito surveillance, implementing control measures, and educating the public about prevention strategies. So it's important to stay informed and updated about West Nile virus activity in your area through the Massachusetts Department of Public Health's website or local news. Take action to follow the prevention methods and contact local mosquito control districts or programs for information on controlling mosquito populations. Final thoughts. Protect yourself and your community from West Nile virus. And the final message is prevention and control efforts can reduce the risk of West Nile virus transmission. Thank you.